Good evening, everyone. Good evening. Welcome, everyone, to the historic Somerville Theater. Thank you for coming. We very much appreciate it. And my name is Maureen Foster. I represent the Alex Foster Foundation. And if it weren't for people like all of our friends and family, many of whom are here, we wouldn't be able to do some of the things we've been able to do. So that being said, I'd just like to say that hopefully viewing this film, people might get a better understanding about the disease of addiction, and maybe it will help to erase some of the stigma that many people still have about the disease. Following the film, there'll be a panel discussion with questions and answers, and we'll have some resource tables. They're already up in the back, so you can get more information if you need it. The City of Somerville Office of Health and Human Services has some goodie bags they'll be handing out, so you can take that when you leave. And there'll also be an overdose prevention training given by Matt Mitchell, the Prevention Services Manager for Somerville, and Sarah Harris, Somerville's Public Health Nurse Manager. Naloxone, also known as Narcan, will be provided to anyone who attends the training while supplies last. Before starting, I would quickly like to recognize some elected officials that have very kindly joined us tonight. We have Councilor at Large Mary Jo Rossetti, Councilor Ward 5 Mark Niedergang, Councilor at Large Wilma Barr, School Committee Member Carrie Normand, and Councilor at Large Bill White. So now I would like to introduce the moderator of our panel and of our evening, Megan Thielking. Megan is a reporter for Stat News. She writes about health and medicine with a focus on mental health.
Thank you so much, everybody, for being here. My name is Megan. I'm a reporter at Stat, the publication that produced this documentary. Oh, sorry, how's that? How about now? My name is Megan, just to reiterate, and I'm a reporter at Stat, the publication that produced this documentary. I just wanted to say thanks to everybody for being here. It's a really magnificent, really powerful film, and I'm excited for everyone to see it. We're going to have a panel after the screening where we'll be talking to people that are in the film, Alex Hogan that produced it, and some experts. But before that, I just wanted to introduce Alex Hogan, who directed the film and is a wonderful coworker, so he'll introduce it.
Thanks, Megan. Thanks, everyone, for coming. This is, pretty overwhelming. This film I made for everyone here in Somerville, I mean, we've all been through this. We all know someone that has suffered from the, awful disease of addiction. And I made this film for you guys, and it's, unbelievable to bring it home to the Somerville Theater in Davis Square. And I really hope you guys all get something out of seeing the film. Thank you.
We lost a lot of friends over the years, a lot. I lost so many that I feel like I got more friends in heaven than I do on the streets.
2,107 Massachusetts residents died of addiction-related causes in 2016. The national number was 64,000 people.
Self-medication is strong around there.
I was welcomed into high school with it. I remember this kid grabbing me and pulling me under his arm like, here you go, buddy. If anyone messes with you, I got your back.
All my friends did it. Everyone in high school was doing it.
It kind of like fell in our laps,
One day I came home and the air conditioner was gone. All the air conditioners were gone.
Rob, steal, take from your parents.
Robbing my mom, my dad. I mean, I was an emotional terrorist.
We're not bad people. It's just, this is what the drug does to you, It turns you into something you're not.
I'm 30 years old, and that's pretty old for a smack addict,
Do oxys, play hockey.
Hot and cold, Xanax, Valium. First one to pass out loses.
To think of all the people that we know that have passed and to think of what they could be doing right now, it's a terrible tragedy is what it is.
I feel like the last man standing, who's ran this long.
I just wanted to say thank you again to everybody for coming and for watching that. I think it's such a powerful piece of journalism, and I was thinking that what Alex said in the film about giving back and more broadly about talking about this issue is so, so important. So I just wanted to say thank you again to the Fosters and the city and everyone who played a part in putting this together and for organizing this panel. So what we're going to do is get started by having everyone sort of go down and introduce themselves and just give you a little bit of background about who they are and why they're on this panel. Then I'm going to ask a couple of questions, and then we're just going to open it up for the audience to ask questions, since I think that will be helpful too. So I'm going to get started with Alex and just pass the mic down.
So thanks again for everyone, and thanks again to the Fosters. Thanks for everyone that helped the theater, the city of Somerville, anyone that had any hand in this. This has been a really cool experience, and I appreciate all the effort everyone put in. And yeah, so I'm Alex. I directed the film with my co-director Matt Orr, who couldn't make it tonight, unfortunately. The genesis of the film was, as I started working at Stat, we covered the opioid crisis pretty extensively, and during the time of covering from a journalistic angle, I kept on having to take time off of work to go to funerals and wakes for people I grew up with. So talking to my editors and my bosses at work, like, can you tell us a little bit more about what's going on where you grew up? And I did, and they're like, would you be interested in telling that story? And, I was like, yeah, I can talk to some people, see what happened. And then, long story short, basically, it became that film over the course of 6 months with all the, incredible contributions of the Fosters and Mike and Mark and Mike Sullivan and Marky and Brianne and everybody. And it was an incredible experience. And I just, I'm just so thankful that people have appreciated it. And thanks again for everyone for being here.
My name's Mark McLaughlin. I'm friends with the director. I grew up with all these guys in Somerville, and I'm just here as a friend and a neighbor and an ally, an advocate, and all those good things. Just trying to bring awareness and I think just tell a story that's not unique, but it needs to be told, and just try to advocate and erase the stigma and break down barriers and start having a conversation around these. It's a really difficult conversation to have, so we appreciate everybody coming out.
My name's... That's not my name. My name's Aubrey Esters. I'm from Revere originally. I lived in Somerville for about 8 years. Ran an underground safe consumption space along with dispensing sterile syringes, naloxone, supplies, monitor people's drug use. I'm currently working drug policy and an organizer and one of the co-founders of the Boston Users Union and SIF MA Now, working to open legal safe consumption spaces for people who use drugs. I'm a person who uses drugs and work in drug users organizing.
Hello. Hi, I'm Dinah Applewhite. I'm a doctor. I'm currently completing my residency in internal medicine at Massachusetts General Hospital. So I care for patients with substance use disorders, both in the inpatient setting, on the floor, in the intensive care unit, and then also in the outpatient setting. I have my primary care clinic in Charlestown, where I treat a lot of patients with substance use disorder and also do a lot of harm reduction. And I think I'm on this panel just because I see so many of the devastating impacts of drug use, and these are all preventable, both because we can expand treatment to substance use disorders and we can also make using safer. So excited to be here.
How you doing? I'm Mike Curtis. As you know, in the movie, I'm a firefighter. I'm not a doctor. I deal with some people that have some issues every day with different aspects of mental health. You see all types of, in the different ranges of drug abuse and the effects it has on not just the people that are involved in it, but their families and friends and everything. So, I'm happy to have all the awareness that's going out, and I'm happy to be a part of it. And I really want to thank everyone here involved and everyone that's been supporting. So thank you.
Hi, my name is Matt Mitchell. I am the Prevention Services Manager here with the City of Somerville in our Health and Human Services Department. I have a lot of background in mental health in community-based settings, and I've seen addiction and kind of how it has taken its course over many different aspects of individuals' lives, from their families to their jobs to everything. So I was excited to be asked to join this panel, and I'm looking forward to hearing some of your questions.
So Alex, sorry, having a hard time with the microphone. Alex, I'm gonna start with you. I wonder if you could talk a little bit about what it was like as a reporter to report on people that you know so well and that you've known so well for a long time.
Absolutely. Just first things first, though, in case anyone was wondering, 0-0 after the first period in the Bruins game. So I know you guys are all, waiting to see how they're doing. So anyway, yeah, that was challenging. I mean, it was so, like, as a reporter, as a journalist, you always want to get the story right, and so obviously the first thing, that's your job, is to always do it right. But there was this extra layer of just responsibility I felt to get this story right, because it's not just my story, but the story of all these people who have been through so much, and they trusted me with their story, coming to Mark and going to Mike and going to Brianne and going to everyone and said, can you, it's not easy to go on camera and tell some of the, literally tell a story of, like, the worst moments of your life. So I had that extra layer of just, like, I want to make sure I get this right and do it right by everyone. And it was difficult. I mean, it's just like, like I said, when you're a reporter or a journalist, you want to make sure you get the story right. But a lot of reporters don't live with and love, and will spend the rest of their life being in good friendships and relationships with these people. So that was, at one point, on one side of the coin, it was very good because I got a lot more access. I felt that they trusted me with their stories. They may not have told that story to someone else that they didn't know. But on the other hand, I felt very a huge responsibility to get it right and do right by everyone. So it was definitely difficult in that respect, but it was very rewarding, and thankfully I feel like everyone felt that the product was representative of their stories.
And Mark and Mike, it's been 2 years since the two of you were in the film. I'm curious how you feel like it has changed, if at all, or really more broadly, how your view has changed of how this crisis is affecting your community in the 2 years since you first saw it.
I definitely think it's just the conversation has changed significantly. First of all, it's a conversation now. That's the biggest thing. We're having the conversation, and it wasn't a conversation that was being had at the time during the beginnings of this crisis. It's a really unique perspective of kind of seeing something that's mushroomed into a national epidemic that you were on the ground floor of from its conception, from the very beginning. And watching it and realizing, so much of this could have been prevented if we were having these conversations, if there was awareness out there. So just, it's a positive step forward, There is that, I think you hear a lot of people with the sentiment of, the unfortunate that it had to get this bad, and it had to affect certain segments of the population for it to kind of be met with the compassion that is being met with now. And that's an interesting conversation to have, and I would certainly felt like that was true within Somerville at the time. I used to do street outreach work for many years, and again, during the beginning of this, and if you asked me who was being affected, I used to be able to, I'd put money, I'd pick 5 neighborhoods whenever I was dealing with someone who was suffering with addiction. I would put money on, I'd make a bet he's from one of these 5 neighborhoods. And that was kind of and now, all bets are off because it's kids from all over the Commonwealth, all over the country, but the conversation's being had. The concern is, what's next, and what kind of, you're playing catch up at this point.
Yeah, for sure.
Really briefly, I think as someone who uses drugs and has been using drugs for over 15 years, this isn't something new. This didn't evolve in the early 2000s. People have been using drugs for thousands of years, and people have been dying from overdoses, accidental overdoses, and fentanyl contamination, other contamination for hundreds of years. This is what caused the opium wars in China. So this isn't really anything new. What's new is the way that public and people want to decide to respond to an overdose crisis that all of a sudden is affecting white neighborhoods. This is that when drug use and overdose and poverty was wiping out neighborhoods of color in the 80s and 90s, and people were being locked up for decades. This wasn't talked about. I think it's important to remember the reason we're talking about this today is because it's affecting white middle-class families.
Yeah, and I'd like to touch on the fact that I think a lot of my generation and the younger generation before, after me, which was my brothers and most of the people in this documentary, the culture was very, at the time, like open about it amongst ourselves. It was talked about and widely known that everyone was doing it. But it's crazy to think back now when I have 2 young kids that, like, you know, people could think, oh, how come no one knew about it? How come no one, you know, was aware that it was going on so heavily? At the same time as it was open amongst us, it was also very secretive, and I think it's very important that parents talk to their kids about it, you know, before it can get too crazy, because it does come out of nowhere. It doesn't discriminate. The culture around that time was very multi, I don't know, diverse and very, I don't know. The drugs hit in pill form, and that's what basically took it to that other level of heroin, basically. And I just think the more education out there, the better. And the past couple of years, it's been a huge increase in it, definitely in thanks to the Foster Foundation and others like it.
So, Aubrey, you touched a little bit about how the view of how the opioid crisis has changed who it is affected has changed. I'm wondering if you and then Dinah and Matt could talk a little bit about, specifically in the last few years, what you feel like has changed, whether that's in terms, I know you all have different backgrounds, so you could address to your own background, I guess. What do you feel like has changed in terms of policy? What do you feel like has changed in terms of access to treatment or preventive services or even research in this area?
Yeah, definitely. I think this is really important. And I think one of the key parts of this conversation that usually isn't brought up is the change in supply. Because what happened with OxyContin and the pain pill crisis, when people were using pain pills, when those pills were stopped, when there was less pills available on the street, a regulated supply where people knew exactly what they were taking because it was coming from a pharmacy, people started dying a lot more. So now we're in a space now the last 5 to 6 years, particularly in the last 3, though, in Massachusetts. Fentanyl contamination is pretty much widespread. Near 98% contaminated drug supply in Massachusetts is fentanyl, and it's in almost any substance other than marijuana. It's very cheap, so it's able to be imported and moved around in different ways that it's a lot less expensive. So I think one thing that we've seen an enormous increase in, from my perspective, is people who are using drugs working with each other and wanting to make sure we keep each other alive. I think there was a lot of, we talk about stigma all the time. When people from the outside talk about stigma, I think it's very different than what people who use drugs talk about stigma and what it means for us, because we still internalize a lot of the external oppression that's put against us. But when we're able to feel comfortable with each other and we're able to even use together and be able to say, hey, I'm doing this, even if you're not with someone, there was a real necessity for people to be with other folks while they're using. I think that's the main thing that's changed. Before, it was important, but it wasn't always done. Now people are more making sure that they're with people, or at least they're in a public place. People are using ties in bathrooms, hospital bathrooms that will pull the alarm if they go out, because people want to live. And so people are coming up with innovative ways to keep themselves and their communities alive, and I think that's one of the big things that's changed. And I think when people who use drugs and people who are in recovery are able to have a voice and speak for ourselves, I think that's a really important turning point. We're starting to see that.
Thanks, Aubrey. I was going to touch on some of the same points, so I'll try to think of different things to say. But it really has been, I think what's changing is the fentanyl. Obviously, overdoses started to rise earlier before fentanyl came on, but with fentanyl, we've seen this just become so much more of a crisis. And I have patients who have used for decades and decades in their 60s, and they're now dying. And people are dying very, very quickly, and people are having to inject way more frequently. So we're seeing cases of HIV go up. So just the things that we are seeing among our patients are just getting scarier and scarier. You asked to comment a little bit on policy without getting, I'd love to get into nitty gritty, but I think some big picture things that I'm hopeful about is that I think that there's been a turn where people are starting to recognize that we really need to start thinking creatively and take some new steps to address this crisis. Obviously, there needs to be a huge push for access to treatment, things like methadone, Suboxone, to get psychiatric care for people who need psychiatric care. But there also has to be a huge push to make sure that we're keeping people who are using alive, even if they want to keep using, and even if they're not ready to stop. And so what that means is that if somebody wants to keep using, they need to have clean syringes. They need to have Narcan. And if somebody wants to keep using, they need to be able to use in safe spaces. Just last week, I was working in the hospital and got called for an emergency because I respond to a lot of the emergencies in the hospital, walked in and there was somebody there who was not breathing, completely not breathing, one of the patients. And it turned out that they had used in their bathroom and was about to die. Their oxygen levels were very, very, very low. And they were in the hospital, so we were able to respond incredibly quickly. We were able to give them naloxone, and they are okay, and they are alive. And so you can imagine the power in that if we could provide safe spaces for people to use to keep them alive. And so I think from a policy perspective, we're really starting to realize that we need to start thinking way more creatively about how to keep people alive because of how deadly fentanyl is and how much this is contaminating the supply, because no one will get to treatment if they are dead.
Ditto. It's kind of hard going after you two, taking all the good points, but one of the things I definitely wanted to highlight is the way that people are thinking about addiction is changing, but also the way that people are talking about addiction is changing. And I think one of the efforts that we try to do here in Somerville a lot is to get people to start to use language that is more supportive of individuals who are in recovery, trying to get away from the dirty and the addict, and kind of classifying individuals by the thing that they struggle with most, and not classifying them as individuals who are struggling with something that can impact them on many different levels. And I also think that one of the biggest changes is the access to Narcan across many different domains. All of our police officers, all of our firefighters are all equipped with Narcan. And if you come to Sarah and I's training, that's not a shameless plug, we will continue to try to equip people as much as possible with Narcan, and starting to get people to understand that that is really a powerful drug that is really helping people stay alive.
Thank you, everyone, for that. With that, I'm going to open it up to audience questions. I think that there are microphones around the room, right? So I think this looks promising. So I'll pass this one around that I have,
Hi there. Hi, Doug. Hi. I want to say hi to the panel, especially to Mark, who we used to knock on doors together, and to Aubrey, who's has educated me as an activist in safe injection facilities. My name is Rivka Lapidus. I've been working with substance users since the early 90s and have learned so much. And want to just say, as a clinical professional, one of the things that has changed is that when I started working and listening to people in Somerville, the talk was about how to get clean, how to be abstinent. There was nothing in between. There was very faint applause for anything that was sort of part way, and there was a one-size-fits-all mentality. I find Somerville has been out in front in dealing with these issues since they hit the community and has grown and changed so much. So I'm really appreciative of the whole community of Somerville, of the work you guys are doing. Special shout outs to all of you, and to also to encourage folks to learn more about safe injection facilities, which sounds like a hard pill to swallow, pardon the pun, but not intended, but really necessary to keep people alive. Thank you.
My name is Joel Nitzberg, and my kids grew up in the city, a little younger than you, but certainly where I saw the edginess of their existence and what they experienced in high school. My son was good friends with Ryan Sullivan. Brianna made an interesting observation about the period of time where gentrification was impacting the kids and families who grew up in the city, and seeing working class Somerville turning into something very different. So I'm wondering, and this is, I work now in the South End, and I'm seeing very similar situation going on in terms of a major change of population and people being left out of the economy. What are you discovering in terms of some of the social determinants of health and how that's impacting the use of addiction as an escape or as a way of looking for possible opportunities away from their conditions?
It's a great question, and honestly, it's a 30-minute film, and if it was going to be a 45-minute film, we probably would have delved into gentrification. We might have delved into gentrification a little further, because I think that's not the first time during one of these screenings we've got that question. And I think it's very relevant to a lot of people that live in this area, because so many of our neighborhoods are changing. I just think that, you know, if you look at a lot of the places that have been particularly hard hit, I mean, the opioid crisis does not discriminate. You'll find the opioid issue anywhere in the country, but it's particularly the certain places that have been particularly hard hit, Appalachia, the Rust Belt. There's a lot of places that once thriving, you know, and are no longer doing so well, and those are the places where are just like being absolutely devastated by the opioid crisis. And I kind of feel like, you know, that's in those places, you know, they're seeing these jobs that were really thriving. They're not coming back, you know, Google and, you know, Twitter aren't moving to these cities, you know, in those parts of the country, but they are moving here. So I think there's a little part of it of that people have to feel like they're being pushed out of a community, they can't live there anymore, but also have to suffer like the further indignity of seeing like, you know, other people enjoy it. So they don't, you know, they don't get to see they lose their sense of self, they lose their sense of, you know, the place that they're from, and I think there's just that extra level of just like, you know, also not having to participate in they don't feel like they're participating in the city that's thriving now. So I think that's just like a little bit different situation of the cities here around about the Boston area, but also other parts of the country that are gentrifying. I just think that our generation was caught in a tough spot where, you know, our parents or the generation prior to us could live in Somerville, you could live in Charlestown, you could live in Southie, and without, you know, making $100,000 a year, you know, and that's no longer the case. So it's just like we're caught in this really right in the generation that OxyContin hit was exactly the generation where that sea change happened. And, you know, clearly there's a million causes of, you know, there's no one cause to why the opioid crisis took hold, but I think that was a non-insignificant factor, at least around here.
Yeah, I just want to add, well, I went to the Kennedy with your daughter, so tell her I said hello. I think, adding on to what he said, and adding on to what you said as well, there's a very complicated conversation around race and class and substance abuse and change in communities, but to be specific to Somerville, I think what you hear a lot of people saying is the change here is very difficult for people to swallow because Somerville's a place that the community is very much tied to your identity. And that's something growing up here, you really identify with growing up here, and people that grew up here, like my family and a lot of people's families for generations. And I think there's a sense of kind of not caused, but kind of coinciding with the sense of feeling lost, the sense of hopelessness, the sense of despair that is around you when your prospects might seem somewhat limited, and a community is kind of thriving on top of you. You're not thriving with the community necessarily. If anything, you're kind of a victim of that. So I think it added to a sense of just being lost and feeling hopeless and not knowing, where to turn. And in particularly, I recall, a very hard time in my life, and a lot of the people in this film, and for the community, I think was the year of graduating high school. Ryan Sullivan had been killed, and that was a tremendous loss to the community. And in many ways, I look at that moment, I have to say, that summer of graduating high school, and it was, for my group of friends, it was chaos. I mean, it was chaos, and you saw a lot of great things being brought to the city, and the city changing, but our lives were completely in chaos when it came to, a 16-year-old person, life being snuffed out, and the substance abuse, and, graduating from high school where Somerville was our world. I mean, you looked forward to, raising your own kids here, and, all those prospects and things, and, there's a literal loss of, the loss is like metaphoric and literal. You're literally losing your community to violence, to substance abuse, and there's a symbolism of also losing your community as well.
Really quickly, I think this is really important, and I think talking about the disappearance of the middle class is a really important thing to think about as well. A lot of people grew up in households that were in the middle class, and we really don't have a middle class left in this country anymore. We're mostly working poor or wealthy. So I think that's another thing that contributed a lot to people being not feeling well about themselves. And when people don't feel well and they need to treat their symptoms, we use things like alcohol, drugs, whatever, Xanax, antidepressants, and some things are safer, some things are less safe. So people need medications to cope with their living situations, especially when you're surviving poverty. And it's a very real response.
I just wanted to comment on some of the research, some of the things that we know really briefly. I don't know if anybody remembers this idea of deaths of despair. Do you guys remember that? It was like all over the headlines. White middle class people are now dying at earlier ages than their parents. This came out in late 2015, and essentially life expectancy was declining among the middle class, and was particularly apparent for people of low education. And so it was termed deaths of despair because it was really thought to be primarily driven by overdose deaths, alcohol-related liver disease, and suicides. And it got a lot of media attention, and I think there really is something to that. I will say it's a little more complicated than that. Subsequent analyses have really shown actually that if you analyze the data how you really should, life expectancy among the middle class is decreasing across racial and ethnic groups, and that it's really not just deaths of despair, it's actually among a broad range of diseases. But I think that goes to show that there is some movement, there's something going on, what some have termed social distress, but there's something going on here. And I think, as Aubrey pointed out, like, there's a lot of reasons why people use drugs. And certainly there's some connection between what's going on in our economic system and what we're seeing.
We can move on to the next question.
Hi, my name is Melissa McWhinney. First of all, thank you so much for being there. Thanks to the foundation for doing this. I used to work for the city. I was working for the city when the first wave of overdoses happened, and I have to say I'm remembering, and I'd forgotten until just now, going to a convocation at St. Anne's Church to talk about this problem. And there was a young man who stood up and said, I use drugs or I abuse drugs. And immediately his father, who was sitting next to him, stood up and said, nobody in Somerville does drugs, and walked out. So we have come a really long way. Thank you. This wouldn't have happened 10 years ago. And it's a terrible thing that all of these tragedies have happened. Actually have a question, which is, can you talk about not only risk factors, but protective factors? I know that there are things that communities and people in communities can do to keep families safe, to keep our children safe. If you can talk a little bit about what those might be, that would be great. Thank you.
So, a great question. Hi, Melissa. I think, like I said before, the biggest thing is preventative, getting out there, talking to people before it could potentially become a problem. Also, obviously, being aware of what's going on around the community, the youth. And one of the biggest things, I think, me growing up was feeling like, you know, high school was a tough time. I was, you know, having struggling grades and whatnot, played basketball and had a lot of, you know, activities available to me, but at the same time, I was also told, you know, pretty much going nowhere. You know, I was kept back twice in high school after doing fairly well in elementary school and everything, but the sense of not really having a solid plan or future opportunity given to me. At the time, trade school, I went into graphic arts at the high school, and pretty much, you know, flipped my perspective around to what I had for opportunities and things I could do on my own, you know. And at the time, I don't think trade school was pushed or, you know, looked at as a good thing. So I think that's a big thing that's changed a lot in the last 10, 15, 20 years, and especially in the recent years, that you don't need to go to Harvard or MIT or UMass Amherst and waste 4 years there to get into a couple $100,000 of debt to come out, to basically come back to Somerville and, you know, do drugs with your friends at the park, play stickball. So there's a lot of helplessness, a lot of, you know, I think just basically talking about it and getting to kids before they can, you know, experiment on their own, having a little bit of knowledge about it will go a long way.
I'd like to echo those same sentiments, particularly trying to find quality out of school time for youth and finding opportunities for youth to do something productive with their time post-school, especially in some of that prevention and knowledge and education for the youth. But another thing I wanted to talk about was just the overall education of the community that we can do, and the protective factor that can really apply. Because I think in the film we had seen a lot of people talk about, you know, I didn't even know how to deal with drugs, or I didn't even know what that looked like. You know, I didn't even know that if my spoons are missing, that meant something was wrong. And I think trying to find any opportunity and meeting people where they're at in terms of communication of the education, because, you know, we're we probably all have cell phones in our pocket right now, and we are constantly on those. And so trying to find different mediums to get this information to people on different types of platforms so that the information's out there and individuals know how to access it in an easier sense than coming to a forum or something like that, and right there at their hand, right at their disposal. So.
One thing I think would really make a big difference in extending prevention of overdose particularly is opening up the floodgates to medication treatment. These are evidence-based things that work. Medications save lives. 50% reduced overdose risk just from being on methadone or buprenorphine. There's absolutely no reason why Somerville didn't, at least when I lived here, didn't have a methadone clinic. Why I had to go to a town over, why there were punitive policies in place for people if they were using stimulants or using something else, people getting kicked off of methadone clinics because they had positive swabs. These kind of policies literally kill people. People literally die when being kicked off of clinic and can overdose within 2 or 3 days with a reduced tolerance. So we're doing a lot better with that, but we need to really, 10 times, 100 times more, open those gates and look at other medications that work just as well, if not better, like injectable opioid agonist therapy.
We probably have time for, are there other questions? Yeah.
Thank you very much for your information tonight. I have a question. I'm a parent who lost a child in 2017 to an overdose. My question to you, the panel, to everybody, how do we get the legislatures, the FDA, how do we get them to offer equal treatment for everybody? You know, you talk about the methadone and the Suboxone. Not everybody has access to that. The insurance companies don't pay for it. I think there's a methadone clinic in Quincy that they're threatening to close down. What the heck are what can we do to get it going? I mean, the collateral damage is ridiculous. Does anybody have any suggestions? Because it blows my mind that I couldn't send my son to an internist for help with his addiction. The doctor said, I'm sorry, I can't help. What's going on here? What can we do as citizens of Massachusetts with voices for the community, voices for our children and future generations? What can we do? Because I am pissed off.
Thank you for your question. I think we'll all probably have something a little different to say, so I'll try to tailor mine specifically to some medical issues. So one of the big problems right now is that Suboxone, it's much harder to prescribe Suboxone than any other opioids. So I can step in day one of being a doctor, prescribe as much OxyContin as I want, but to prescribe Suboxone, you need to pay for your full license, you need to undergo a training, and then you're capped with the number of patients you can prescribe to. So this is outrageous, this makes no sense, and this needs to be changed, and that would be a federal level change. Another thing that makes no sense is methadone. Methadone is currently only available in methadone clinics. I prescribe methadone for pain from my primary care clinic, but if I want to prescribe methadone for a substance use disorder, I am not allowed. And so physicians in this crisis need to be able to prescribe methadone from clinic. So those are two pretty simple moves, okay? We're just changing how we can prescribe medications. Yeah, sorry. Oh, okay. So I think that those are two low-hanging fruit that just to let people access more medications that we know work for them. There are lots of other things we should be doing that I'll I think you guys can probably comment on as well. Or I'll let Aubrey maybe talk about supervised consumption spaces.
Yeah, thank you. I think one really important thing you can do is call your elected representatives, especially in the State House, in the House and in the Senate. Tell them why you're concerned. If you can, get an in-person meeting with these folks. With CFMA now, we've been doing lobbying at the State House for the last 3 years, and having parents, particularly family members of people who use drugs or who have lost loved ones to overdose, is one of the most important pieces of the conversation for people that are policymakers. When parent groups come in, they listen. They listen more than they do listen to a person who's using drugs at the time. So you have a very key role that you could be playing. I would be talking to all your state reps and the state senators, going to the State House. When there's Project Able, it just happened this past week. There's other actions that happen at the State House all the time. And if you want more information about safe consumption legislation and other harm reduction efforts, we can talk to you later.
Just quickly, I think that as we just discussed, there is evidence-based that a lot of these treatments, Suboxone, methadone, do work. There's a perception that a lot of people have that it's like, oh, you're just swapping one drug for another, which I can see that people see it that way. But a great analogy I heard from Michael Botticelli, who was in the film, he's actually trying to quit smoking. And he compared a lot of these drugs, Suboxone or methadone, to a nicotine patch. It's like, yeah, the base of the drug is the same, very similar chemically, but you're reducing the hazardous behavior of smoking with nicotine patch. You're not smoking, you're no longer inhaling, the chemicals. In just the same way as that if you're using heroin and you're using Suboxone, you're no longer injecting, you're no longer using drugs that you don't know the source of, you might not know the dosage of. So it's a harm reduction strategy, and I just think that's an important thing to keep in mind, and not just dismiss it out of hand as it's just trading one drug for another.
And let your clinics be opening in your neighborhoods. If your neighborhoods are saying we don't want methadone clinics here, that's what's keeping these clinics out.
One thing to piggyback off of what Aubrey was saying about engaging parents and families, I think engaging youth in this topic, as much as it may seem like counterintuitive to some of the things, the youth know what's going on. I think in the film they talked a lot about, it was secrets, things we were keeping it from parents or obviously and some teachers, but engaging youth and having that powerful voice at the table, they have friends that are dying from this stuff and are also going into treatment programs and such. So their voice, as we're seeing in many different arenas right now, the youth voice is a very powerful one that can really be impactful on a senator or some type of legislative individual. So youth is a big part of what we should be looking at as well.
I just want to add to that like she was saying about, if you don't want a methadone clinic in your neighborhood and you think it's not going to, help your property values. And some people see like safe injection sites. I don't want that next to my house. And it's like, hate to tell you, but your neighbor's probably shooting dope and you don't even know it. So, it can save lives and it's really important, I think. So, something to be, researched.
Do we have time for other questions?
I just wanted to know, are they showing the film in schools? Because they should. I know all the kids that were in the film. I knew them since they were little boys, and I know all the parents, and I know they're good parents, And I think parents can talk to their kids about drugs, but are the kids, if you're just saying no, they're going to do it anyway. But if they're watching a film like this where they're seeing kids who are talking about their friends that aren't here anymore, that could have a much bigger effect. So I almost think it should be mandatory. Every school in the state,
I think it should be mandatory too, yeah.
No, it's
To answer your question, it has been. Yeah, a bunch of schools have reached out to us, and it has been in some schools, which is great. And we have a policy of any school that is using it for educational purposes, we make fully available to them, and whatever format they need, we make sure they can see it. If they need a DVD or whatever, we make sure they get what they want. If they want it, they can. We absolutely. So. In as many schools as we get into is definitely one of the goals of the project, because the whole point of the project was to, raise awareness, and hopefully, if imagine if it kept even one kid from, going down a path of drug usage, would be very powerful. And I just think that, I think if anyone wants us in any school or in any way possible or in anywhere, just let me know, and I can make that happen for sure.
Really quickly, having drug education in schools that is not abstinence-based has been proven to be so much more effective at reaching young people. So that's something else you can look into. There are a lot of really quality, non-abstinence-based drug information and recovery information teachings in public schools now.
Well, thank you. Oh, one more? Yeah, for sure.
Hi, I just want to bring up the fact that I've worked in a hospital for over 30 years, Boston Medical Center, and when I worked in the ER, we would have patients that are addicted to alcohol or addicted to drugs, and we would get them detox if they wanted it, and it was 3 days. Hence the problem, you can't fix anything in 3 days. I said, what the government needs to start doing is opening more detoxes, more halfway houses, also more education. I totally agree with that this should be shown in every school. If they're afraid to show it to younger kids, maybe it could be changed or tweaked a little. But until the government, federal, state, and local starts sinking some money into this, nothing is going to change. Because it's really, I keep hearing that Massachusetts is doing better. I don't see it. I get the EMS stuff on Facebook, and now it's called the person was found unconscious. And it's all the time, every day, and it's not stopping.
Yeah, I think that's definitely something that we've seen just working as journalists, that it's really everywhere. Alex has obviously covered Somerville, but our team instead has been all over the country, and it's certainly something that's really rampant across the whole country. Well, I just want to say thank you again to the panelists for sharing their insights and their thoughts and their perspectives, which have been so valuable. And thank you everyone for coming.